Good afternoon, everyone, on the webinar today, and welcome, warm welcome from the OECD Secretariat. This is Anne Gourmelon speaking. I am the Principal Administrator of the Test Guidelines Program, and we are launching this new series of webinar on testing and assessment methodologies. And at the request of some of our stakeholders, or most of our stakeholders, who asked to receive a bit more communication on some of the ongoing projects at the OECD. So we are starting with one that is getting attention at the moment as it concerns new methodologies and defined approaches for skin sensitization. So this afternoon, my colleague Patience Browne is going to give this webinar. I'm going to now give the floor to Patience. Please note that for the quality of the audio, we have muted everyone.
Thank you very much, Anne. It's my pleasure to be here today to talk with you a bit about this ongoing project that we have underway at OECD. And I should say that this is really going to be a high-level overview of the project as it's really developing as we speak. But I can talk about the progress that we've made to date, and that this is really quite exciting and something quite new. Okay, so first of all, I'd like to talk a little bit about defined approaches and how defined approaches are similar to and contrast with integrated approaches to testing and assessment, or you may know them as IATAs. So IATAs are really a way of addressing specific regulatory problems, and they begin with, first of all, problem formulation. And then the next step in the IATA process is to assemble all existing information. And this likely includes sometimes physicochemical information, in vitro information, in vivo data, and oftentimes in silico predictions as well. And so once all the information is assembled, there's a determination of whether or not there is sufficient information to address the regulatory problem and come to a conclusion. And if so, it's relatively straightforward. And if not, then more information is generated to overcome potential gaps. And again, there's a weight of evidence assessment to determine if the information is adequate. So some of the issues around this are IATAs are inherently flexible to address specific problems, and how the information that's gathered in the first place is targeted in terms of which databases are identified and the search terms is highly variable, and there are multiple different ways of addressing those. And of course, coming to a conclusion on whether or not there is adequate existing information or what potential information needs to be generated involves some level of expert judgment. So these are flexible and intended to be flexible. And in fact, the types of IATAs are somewhat of a continuum and range from expert-driven, judgment-based on the left-hand side of this slide to something that's inherently more prescriptive and rules-based. And really defined approaches are one specific type of integrated approaches on the right-hand side of a rules-based approach, and can be included with other data or can be standalone methods for evaluating existing information or new data. So for our purposes here today, a defined approach to testing and assessment consists of a fixed data interpretation procedure that's used to interpret data that are coming from defined information sources. So another way of saying this is that any two people using the same information sources and the same fixed data interpretation procedure should come to the same conclusion. These are not flexible, and they're intended to satisfy a particular regulatory need. In the last couple of years, OECD has published several guidance documents on defined approaches. The first of these is guidance document number 255 that describes an approach to reporting defined approaches so that they are transparent and reproducible. And the second is guidance document number 256 that includes a number of specific examples and evaluates defined approaches in the context of IATAs for skin sensitization and actually includes 12 skin sensitization case studies, which we'll discuss a bit today. And I should say that both of these documents are freely available, publicly available through the OECD Series on Testing and Assessment website. I want to mention another guidance document that OECD has published, and that's guidance document 260. And this is guidance on how to use adverse outcome pathway frameworks to develop novel testing and assessment approaches. So these include both the flexible IATAs and defined approaches as well, and we'll talk about how AOPs fit in the context of our example here today. Again, this is a document that's publicly available. So our discussion today on skin sensitization and defined approaches is really an example of how existing OECD tools can be combined to create a new product. As I mentioned, we have the AOP guidance for how to use the framework in evaluating new testing and assessment approaches. And in fact, the full AOP for skin sensitization has been described and is available at the AOP knowledge base. The AOP for skin sensitization includes a mechanistic basis for a molecular initiating event, all key events in the adverse outcome pathway, and leads to, in this case, the adverse outcome being skin sensitization. And these are really testable events. So if you're interested, the link for the AOP knowledge base is provided, and later in the slide presentation, the specific AOP is referenced as well. In addition to the known and described AOP for skin sensitization, there are a variety of OECD validated test guidelines for this endpoint, and these include some in chemical tests and non-test strategies, as well as in vitro test guidelines and in vivo test guidelines, and I'll talk about some specifics on that in a bit. And then lastly, the OECD QSAR toolbox has a structural alert and some predictive capacity for skin sensitization. And I should say that the AOP QSAR is really built around the information that comes out of the test guidelines and has been generated over the last decade or so. So these can be combined together, and here's an example of how this might work. So we have at the top of this slide the defined approach, sort of a generic defined approach, starting with properties of the chemical itself and a molecular initiating event, proceeding through multiple different key events at the cell and tissue level, and eventually ending at an organ level response. And as I mentioned, the AOP for skin sensitization has been well defined. But perhaps somewhat uniquely in this circumstance, we have multiple validated methods to interrogate multiple different both molecular initiating events and key events on this pathway, and those are shown on the bottom of this slide. And this is really an extraordinary advantage for building a defined approach. So in this case, we have specific test methods and non-test methods that can be used together in defined combinations, and being used together, they really overcome some of the limitations of the individual methods. And in addition, there is also a data interpretation procedure that is fixed, and I'll talk about specifically what I mean in the context of a couple of different defined approaches. But the take-home message here is because the information sources are fixed and have been identified and are conducted according to very rigorous test guidelines, and the data interpretation is fixed, it removes the aspect of the expert judgment from this process. And once again, this means that any two individuals or laboratories or regulatory authorities that are relying on information from the same defined approach should come to the same conclusion. We have an extraordinary amount of background information on the defined approach endpoints, and this, along with the case studies that were described in guidance document 256, led to the development for a proposal of a guideline on defined approaches for skin sensitization. This was a project that was proposed in late 2016 and added to the OECD Test Guidelines Work Program in 2017, and the Joint Research Center of the European Commission, the US, and Canada co-lead this project. And I'll talk about some other collaborative work that they did that was foundational in just a moment. But just to give you an idea of what the aims of this particular project are, the intention here is to develop a guideline for defined approaches that would substitute the need for animal testing for skin sensitization based on, as I mentioned, a combination of methods which individually predict key event responses on the AOP, and used together in combination can overcome some of the specific limitations of those methods. The defined approaches will be evaluated based on their performance against one of the existing in vivo methods, that's the local lymph node assay test, and also against human data. And I'll talk about the human data that are available for this endpoint in just a moment. The resulting guideline would be an instrument that would be amenable to the Agreement on Mutual Acceptance of Data. So this would be much like an OECD validated test guideline. The data resulting from this guideline would be accepted by all OECD member countries and their member country partners that have a regulatory requirement for skin sensitization. But in order to meet that regulatory requirement, we need some flexibility in the information provided by the defined approaches. They need to be able to discriminate between skin sensitizers and non-skin sensitizers, so that's just a hazard ID binomial distinction. We need defined approaches that can discriminate between strong and moderate sensitizers as well as the non-sensitizers and reflect the GHS potency categories. And hopefully eventually we'll have defined approaches that also provide continuous quantitative measures that can be used directly in a risk assessment. So these are kind of three different levels of information that come from different defined approaches. I should mention that the guideline for defined approaches for skin sensitization will meet a direct and immediate regulatory need. As I'm sure many of you are aware, the recent changes to Cosmetics Europe regulation prohibit animal testing and use of animal data for determining chemical safety for cosmetics ingredients. So right now we have OECD in vitro test guidelines, so alternative data that are not considered standalone replacements for the animal test. So we have an industry that's already required to meet this regulatory need, but doesn't have a tool that has been accepted globally and don't have information on how to interpret the information. So what we're talking about here is a defined approach guideline that would be eventually officially endorsed as a replacement for animal data. This, as I said, would meet the regulatory requirements because there is some challenge to how regulators interpret the data coming from industry, given that there isn't an existing test guideline at this point. So as I mentioned, the leads from the JRC, the US and Canada, were also involved in a very large project with the Cosmetics Europe Consortium. And there are two papers that describe this effort. The first is generation of a Cosmetics Europe database. This is data that are coming primarily, of course, as you might imagine, from industry. And then the second is an assessment of the defined approaches against this Cosmetics Europe database. And the defined approaches that are described in that publication are the 12 case studies that were included in Guidance Document 256. So these are companion papers. They were published in Critical Reviews in Toxicology in 2018, and this is really foundational information on this project. So the Cosmetics Europe database provides a relatively large chemical database for 128 chemicals, and we have a lot of data on these 128 chemicals. We have in vitro test methods for all of them, including data from the 7 OECD validated test methods. There are in silico predictions from both the open source OECD QSAR toolbox for many of these chemicals, as well as from some commercial software that's available as well. There are guideline in vivo data for these chemicals. This is generally the local lymph node assay, but also may include the Buehler test that's conducted in guinea pigs. And most valuable, perhaps, for determining human relevance, there are human data for these 128 chemicals. So I know the chemical names are too small to read. Those that are interested, all the data is available through those publications I mentioned in the supplementary information. But the really take-home message here is that we've got an exceptional amount of information on these chemicals. So one of the first goals of the project, because this was intended to be a new OECD instrument, something different than the existing test guidelines, was to convene a special session of the working group of the national coordinators of the test guidelines program to discuss the project, to discuss how this might progress and provide some feedback on the first and important steps. So that meeting was convened at the end of 2017, and one of the first recommendations from the working group from the national coordinators was to convene an expert group for defined approaches on skin sensitization. There is an existing OECD expert group on skin sensitization and in vitro methods, but The discussion identified perhaps some different expertise, people who were more versed in silico predictive models and statistical methods that really needed to provide input on this new product coming from OECD. So we heard that request. We requested nominations from the national coordinators in early 2018, and we now have an expert group of over 50 individuals that represent not only regulatory authorities from member countries, but also from industry and from animal welfare groups. We've had a number of teleconferences over the last year or so, and I'll talk a little bit about some of the things that have occurred during those discussions. One of the other things identified by the WNT was the need to update the existing defined approaches that were in Guidance Document 256. It was already a couple of years later than the publication of that document, and also to request any new defined approaches that should be considered in this large project. So again, in early 2018, we sent requests to the individuals that had developed the original defined approaches in Guidance Document 256 and to the WNT to ask for new nominations. As I mentioned, there were 12 case studies in that original document. 10 of the 12 were either updated or requested to move forward for evaluation, and there were also nominations from 2 new ones. Okay. So this is a bit of a busy slide. These slides will be posted after this presentation for closer consideration. But this shows the original starting point here, the 12 case studies that were presented in Guidance Document 256 and the various information sources that are included in them. And then this is the 12, and again, there's overlap between 10 of the 12 of these. It's not an identical duplication, but the 12 defined approaches that are under consideration for potential inclusion in the guideline. And you can see on the right-hand side that there are 5 of those that are limited to just hazard identification, so sensitizer, non-sensitizer, while the remaining 7 offer potency categories. So additional steps following that December 2017 meeting. The WNT recommended that we not take on all 12 defined approaches at the same time, but rather start with the most simple defined approaches to gain some experience. And we identified so-called Group 1 defined approaches that were relatively simple in that the data interpretation procedure was rules-based and didn't involve complex statistics. And the information sources included validated OECD in vitro test guidelines and in silico predictions. So the first 3 are identified there, the 2 out of 3 method, the cow sequential testing system, and the cow integrated testing system. And there was also a suggestion on the cow ITS that initially in the Guidance Document 256 included in silico predictions from commercial software be evaluated for potential substitution with the OECD QSAR toolbox, and we call that version 2 of the same defined approach. That evaluation was done about halfway through 2018 and really didn't change the prediction much at all. The WNT also recommended that we use an iterative approach as the project progressed and to learn from the outcome at each step and apply that as we moved forward, and to propose evaluation criteria and a framework for evaluating the defined approaches. So the proposed criteria were circulated. They were actually initially proposed in the publications I mentioned, and then refined based on feedback from the WNT and from the expert group, and those were finalized in 2018. And then one of the next recommendations was to actually use these as test cases. So to use the evaluation framework and the reporting template, the evaluation framework that was agreed upon, the reporting template that's Guidance Document 255, to determine if the information therein would be adequate to address the needs of mutual acceptance of data. If there were any omissions or obstacles or any standout gaps in the information at that point. So this just shows the evaluation criteria that were agreed upon. As you might imagine, these look quite similar to evaluation criteria for test guidelines. They provide some additional details for particular topic areas, and again, that's a little bit more detailed than I wanted to discuss today, but the description of these various categories is in a publication by Cosmetic et al., and we can include that reference as well. So we asked members of our expert group on defined approaches to be our volunteer reviewers. And while the reviewers had varying conclusions on whether or not the defined approaches were ready for a guideline at that point, they indicated that there were no substantial omissions based on the evaluation framework that's identified here and the reporting template, and that these data resulting from defined approaches would potentially fall under mutual acceptance of data. So this is really good news. So just briefly, this is the schematic of the 3 Group 1 defined approaches, and of course you can see there are 4 figures here. Just to reiterate, on the bottom here we have the original COW ITS defined approach, which includes predictions from commercial software from the DEREC package, and then the version 2 where the OECD toolbox prediction has been substituted. For the 2 out of 3, this is really relying on results of the in vitro test guidelines. So if the first 2 are concordant, there's no need for a third. If they're discordant, then the third in vitro test is run. And it's really, obviously, as you might expect from the 2 out of 3, the conclusion from 2 of those. The COW STS requires the first step be the HCLAT, and based on the minimum induction threshold from that step, the chemical is determined to either be strong or weak from that initial first in vitro method, and then the second in vitro method helps to discriminate weak from non-classified or non-sensitizers. And then, as I mentioned, the COW ITS is an integration of not only the 2 in vitro methods, but also in silico approaches, and it's simply a scoring based on the results of the in vitro and the in silico. So these are data that are taken from the Cosmetics Europe Part 2 publication, and these are the initial, there's some change to these in that the initial predictions were against different potency categories, and these have been refined to predict the GHS category. But when we look at the prediction of the defined approaches that are capable of predicting the 3 potency categories against the LLNA data, you can see that in general, agreement is pretty good. I should say that we are currently in the process of determining the highest quality LLNA reference chemical set to determine the predictive potency or predictive power of the defined approaches. So these numbers are subject to change, but the take-home message here is when you look at the prediction for example, non-classified or non-sensitizers, the misclassification tends to be only 1 category away with 1 chemical exception. So the predictions are quite good in terms of agreement between the defined approaches and the LLNA, and when there is disagreement between the categories, they tend to be 1 category off. In only 1 chemical example, do you ever have a chemical that is a non-sensitizer, or non-classified, that's identified as a strong or extreme sensitizer? And the same in reverse is true. In only 1 chemical case do you have a chemical that is, and this data don't actually show that, but where you have a strong sensitizer that's predicted to be no classification. So we got through December of last year and addressing some of the recommendations from that meeting. In October of this past year, 2018, we had a first draft of a guideline and a supporting document behind that guideline circulated for expert review and WNT comments. Following that commenting round, we had a November meeting of the IATA case study projects and the QSAR Toolbox Management Group to provide specific input on in silico predictions in the context of defined approaches. And conclusions from both that October and November exercise were discussed at a very recent December 2018 defined approach expert group meeting held here in Paris. So just to give you kind of an overview of those 3 milestones, the guideline and supporting document, both of which the drafts that were circulated in October are available on the public website if you're interested in taking a look at those. But the guideline is about 30 pages long. It included those Group 1 DAs, those first 3 I mentioned, and the version 1 and version 2 of the COW ITS. The intention is really that this is focused on implementers of defined approaches, of the users of the guideline. It clearly distinguishes between defined approaches for hazard identification and those that can be used for potency classification, but the document is relatively short. In contrast, we have a relatively long supporting document that's about 140 pages, and this is really intended to be similar to a validation report. This focuses on analyses of reproducibility, of uncertainty, of applicability domain, and predictive performance of each of the defined approaches, as well as some of the underlying information sources as well. The supporting document includes a variety of previously published information, both in peer-reviewed publication and in other OECD guidance documents, but it's consolidated and available in a single document for ease of reference. Moving forward a year to the December 2018 expert group meeting and review of these draft documents, the expert group identified some technical limitations for the defined approaches that needed to be better described in the supporting document. For example, the defined approaches are not suitable for some chemicals, particularly those that are insoluble or highly cytotoxic, some that may be metabolized, and for metals. The group also identified a need to quantify the reproducibility of the defined approaches and not just the individual elements of the defined approach, for example, the in vitro test methods. There was a fair amount of discussion around how to define the applicability domain of defined approaches, because there are some different approaches to how applicability domain is described for in silico or QSAR approaches versus in vitro methods. And there is a proposed approach that is presented and was well supported in the supporting document that will be refined and applied to the remaining defined approaches. And there was also a fair amount of discussion around quality assurance of in silico data. To date, in silico data have not been subject to mutual acceptance of data, so there was discussion around the transparency and reproducibility needs to be able to meet those same standards. So the conclusion of, or one of the conclusions of that December meeting was that the specificity of the cow STS was not adequate to retain it for a guideline at this time, but that both the 2 out of 3 and cow ITS would move forward in a refined draft guideline that will be circulated in 2019. So this has been a very active project, an active expert group. The leads have done a great deal of work. Just to kind of go back through what we've discussed so far, there's been an evaluation for defined approaches of skin sensitization that has been agreed upon. We've engaged the expert group to evaluate the suitability of that evaluation framework, and the feedback we got indicated that there was no information that was missing or criteria that were missing that would result in an obstacle for mutual acceptance of data. We substituted open source in silico predictions for commercially available in silico predictions in the cow ITS. There's been a more in-depth analysis of the false positives and false negatives across defined approaches for both hazard identification and potency category. So those were summarized briefly in the current draft of the supporting document, but will be described in more detail to really identify where those false predictions are and gather some information about the chemicals that were not correctly identified. There has been an analysis of uncertainty in the animal reference data. So as we are increasingly aware from these metadata analyses, there's actually a certain amount of discordance between chemicals that have been tested multiple times in the same in vivo method. So how to capture that has been discussed in some detail as well. There's been some analysis of effects of uncertainty in the in vitro assays through the defined approaches, so how the uncertainty from the specific assays is propagated and how to capture that. There has been an approach developed to describe the applicability domain of defined approaches. As I mentioned, this is really requiring kind of merging 2 different philosophies in the in silico and in the in vitro world to capture the applicability domain of the data predictions from the DA. And then we engaged the QSAR expert group to provide feedback on what kind of information from in silico data could meet the requirements of mutual acceptance of data. So this is really around description of workflows and reporting of the predictions that are included in defined approaches. So where do we go from here? We have a lot of recommendations from that December 2018 meeting. So the next step is to implement those and to revise the guideline and supporting document. We will certainly circulate it initially to the defined approach Skin Sensitization Expert Group for input and initial preview, and then it will be circulated more broadly to the WNT for a second commenting round and also posted for public comments as well. And we'll also ask the WNT to provide input on the timeline for when this guideline might be available through OECD. So I also wanted to mention a few additional efforts by the co-leads, primarily conducted in the US, that will be undertaken in 2018 and 2019. And this is specifically to expand the substance-based coverage. So as I mentioned, this high-quality data for 128 chemicals came from the Cosmetics Europe database from that collaboration. So it's primarily cosmetics ingredients. The US National Toxicology Program is generating some additional in vitro data using 3 in vitro test methods on chemicals that are used in plant protection, so pesticides and agrochemical formulations, as well as single ingredients, some personal care products, and some so-called challenging chemicals that have been difficult to test. So there's over 200 substances that have been procured, and testing is underway on that. And even though the Cosmetics Europe database is cosmetics ingredient chemicals, I should say that it's actually quite a bit more broad than simply fragrances and things like that, and personal care products. You can see on the left hand of this slide, from those 128 chemicals, there are various US EPA actor use database categories, and a variety of those chemicals are actually used in things like inert food additives and ingredients. They're used in industrial products and a variety of other categories. So it is much more broad than just simply cosmetics ingredients. And on the right hand, you can see that many of those chemicals are actually used in more than one. About 80% of the chemicals are used in at least 2 of those categories. So it's quite broad. And just to give you another indication of the chemical space that's covered by the Cosmetics Europe database, this is a plot in pink of the Cosmetics Europe database principal component analysis using 6 physicochemical properties. We didn't have the information on all of them, so it's 122 of the 128. But those are overlaid on top of the ToxCast chemical space for the same information, and the ToxCast, Tox21, I should say. The Tox21 chemical space is over 8,000 chemicals, and these are chemicals that were identified from a variety of different regulatory lists and identified as internationally important. So you can see that, once again, from a different perspective, the Cosmetics Europe database is quite broad in terms of the chemicals that are included. So independent of OECD, but simultaneous from this project being added to the OECD work plan, I should say that the US EPA released a draft interim science policy statement on the use of alternative approaches for skin sensitization. This was released in April of 2018. And this policy statement applies to pesticide active ingredients, inert ingredients, and single chemicals that are regulated under the TSCA regulation. The US EPA will now accept 2 of the candidate Group 1 DAs in lieu of animal tests. So we already have an example where regulatory authorities are accepting defined approaches rather than the animal data. And this agreement to accept these data includes other assays that are covered by the key event-based OECD test guidelines, so that AOP we showed. So that's just to say that this really is getting some regulatory acceptance. So as I mentioned, this has been a very active project. There's been a great deal of work that's been conducted in the last year. We anticipate a great deal of work being conducted in the first half of 2019 to have a revised guideline and supporting document for comments. And we will keep you updated through various websites. But here's just a few websites that you may want to visit on general information of OECD testing of chemicals. New draft documents as they become available. As I mentioned, those will be available for public comment, and they're available for WNT commenting at the same time. And some information on our chemical safety newsletter on registration and subscription for more information. So thank you very much.
I hope you found this webinar useful and informative. I would like to thank you all for your attendance today, being with us, and there will be more of these webinars in the future. They will be announced, and if you are interested to continue participating, and you will receive the information through the channels to which you already received this announcement. So I wish you all a very good day, and looking forward to further webinars. Thank you. Bye.